So I'm going to talk to you about introduction to parasomnia, classification, and also how to approach patients who have nocturnal events. Parasomnia is a part of the heading under nocturnal events. So nocturnal events are events which happen during the night during the patient's sleep. Sometimes they can cause injury to the patient or to their bed partner. They cause sleep disruption, and this can in turn lead to psychosocial problems. Some of these nocturnal events could be due to some underlying medical disorder which leads to arousals during the night. For example, patient having severe COPD can have some cough or sputum production which can lead to multiple arousals. Nocturnal events are classified as parasomnia, sleep-related movements, or neurological, medical, or psychiatric events. Next, we come to parasomnia. Parasomnia is defined as an undesirable physical event or sensory experiences which occur with entry into, during, or arousing from sleep. They mostly involve common and usual behaviors, but sometimes we can see unusual events and bizarre events which seem like purposeful movements, and patient can have perceptions, dreaming, and can have autonomic output also. Sometimes the movement disorders which happen at the transition between wake and sleep or sleep can mimic parasomnia. They also can cause harm to patient. So this is the classification. So we have three different types of parasomnias, which is the non-REM sleep-related parasomnia, REM sleep-related parasomnia, and other parasomnias which do not fall into the category of non-REM or REM sleep. So non-REM sleep-related parasomnias include disorders of arousal, confusional arousal, sleepwalking, sleep terrors, and sleep-related eating disorder. REM sleep-related parasomnias include RBD, which is a REM sleep behavior disorder, recurrent isolated sleep paralysis, and nightmare disorder. Other parasomnias which can happen both during non-REM or REM or cannot be categorized under these categories are the exploding head syndrome, sleep-related hallucinations, sleep enuresis, parasomnia due to a medical disorder, parasomnia due to medication or substance use or abuse, and there are some which could not be classified at all, and they are called the non-specified parasomnias. So the parasomnia is mainly a mixture of states. So we have three states. One is the wakeful state, another one is a non-REM state, which is a sleep state, and also the REM sleep state. So if you have a mixture or one state intrudes into another, you end up with a parasomnia, or it can trigger off a parasomnia. Most parasomnias, we do not have a clear-cut neuropathology. There are certain medications which can also trigger parasomnia by altering the sleep architecture, or sometimes they can also lead to arousals which can lead to parasomnias. Some parasomnias are related to certain neurodegenerative diseases and also autoimmune diseases. For example, Lewy body dementia or Parkinson's disease. Medical problems like COPD can provoke an arousal. So during a sleep state, you have a wakeful state. So intrusion of the wakefulness during the sleep state and can lead to a parasomnia. There are certain events that occur at night and present as parasomnia. So these are medical problems which can mimic a parasomnia, like nocturnal seizures, hypoglycemic episode, or patient having psychiatric disorders like dissociative disorders or panic attacks.